Hi, I'm Travis. Here's my medication administration video. Okay, so we have medications to give to my patient, Marge Simpson. I'm checking the MAR sheet right now. I would normally be doing this electronically. I can see that my patient has allergies to penicillin and sulfa, and I have an order to give acetaminophen, NPH insulin, and Zofran, so I will not be administering any of the medication she is allergic to. It is 9 a.m. in the morning, and I'm going to give the first medication that it was ordered, so acetaminophen, 325 milligrams by mouth daily. So I'm at the Pyxis. I'm checking the MAR. The order is for acetaminophen 325 milligrams by mouth daily, PO, and it has not been given yet, so I have checked and it is the right time. I already checked I have the right patient, Marge Simpson. I need to give acetaminophen, so I'm going to grab the acetaminophen from the Pyxis. I'm going to check that I have the right drug. It says acetaminophen. The label says 325 milligrams. For the tablet, which is the exact dose that I need to be giving my patient. So I have the right medication, I have the right patient, the right drug, the right dose, and it's a tablet, so it's to be given orally, so I have the right route by mouth. Now I read the next, so I set that aside. Now I read that I have to give insulin NPH 20 units sub-Q daily. Again, so I make sure, I check I have Marge Simpson. I'm in her chart right now. I pull up NPH insulin. The order states to give 20 units sub-Q daily. I've checked the MAR, and I'm checking the MAR, and it has not been given yet. So, and I verify with another nurse that I am pulling insulin, and I'm going to need them to witness for me here shortly. So at this point, that I have checked that I have the right patient, the right drug, the right dose, the right route. It's the appropriate time. And I have a nurse on standby to help witness the med pull and preparation for me. So I set the insulin, sorry. I forgot to double check the label. NPH insulin, 100 units, and then the order's for 20. So it's the right dose and the right drug. I set that aside with the acetaminophen. Now I check the MAR. I see I have an order for ondansetron. The patient hasn't had it in 6 hours. The order is ondansetron 4 milligrams IM every 4 hours, PRN for nausea. So it's been over 4 hours, so I know it's the appropriate time. I pull up ondansetron on the Pyxis. It pops up. I notice that I verify that I have Marge Simpson, that it is Zofran. I have Zofran in my hand now. In the vial states it has 2 milligrams per ml. And I need to give 4, which means I'll have to give an equivalent of 2 mLs. So I have the right patient, I have the right drug, I have the right dose. I will have my insulin needle as well. It's the appropriate time and the appropriate route. I'll put that to the side. I have one more. Oh no, that's all 3. Okay, so I'm done with my first check. So my second check, I'm going to be prepping these meds, these 3 medications. So moving forward with my second check, I'm going to pull up the MAR again. I'm going to verify that I have the right patient, Marge Simpson. I'm going to check allergies again, penicillin and sulfa. I'm not administering any of those medications. I'm going to go back to the MAR again. I have acetaminophen in my hand here. So I have the right medication in my hand. I verify acetaminophen, 325 milligrams on each, the label and on the order to be given by mouth. It is a pill, capsule. So I have the right patient, I already verified. I have the right drug, acetaminophen. I have the right dose, 325, and the right route, PO, and it's the appropriate time because it's to be given daily. So I'm going to set that aside again, and I have a med cup to be giving that to the patient with. Also, I would have a cup of water prepped, or I would grab one on the way in. Next drug is the insulin NPH. I have it in my hand. I verify the patient. It's Marge Simpson. I have the right patient. It is the right time because it is given daily, and it has not been given yet. So I'm going to pull 20 units into an insulin syringe. I'm going to first clean the top of the vial with an alcohol wipe. for 15 seconds. I'm going to let it dry. I have my insulin syringe. I need to pull 20 units. Going to scoop, grab by the base and seal it. It's 20 units. I'm going to have a nurse verify with me that this is 20 units of NPH insulin for the right patient, to make sure I go over the 5 rights with her and she verifies everything for me. So I have the correct insulin syringe. I have pulled 20 units. I've put the safety cap back on, had an RN verify it. I'm going to set this aside with my acetaminophen. Now I'm going to go into my last medication, which is ondansetron. Zofran 4 milligrams intramuscular every 4 hours as needed for nausea. She has not had it within the last 6 hours, so that meets the appropriate time. So I have the right time. I verify that I have Marge Simpson. I should have did that first. I have ondansetron in my hands. Verify that I have Marge Simpson, correct patient. I have ondansetron, orders for ondansetron, right medication, dose 4 milligrams. So I need to pull a total of 2 mLs because this is 2 milligrams per ml, and I need 4 milligrams, so I need 2 mLs. So I have a blunt fill needle on a 3 ml syringe. So I need 2 mLs total. I'm going to scoop, grab the base, click. I also need the 2 mLs in there. I need the appropriate route, which is intramuscular, so I have to change out the blunt fill needle. So I'm going to remove the blunt fill needle, put this in the appropriate puncture-proof sharps container. I have the appropriate needle head for the IM injection. I have the 23 here. I'm going to maintain asepsis here, so open it, attach it to the 3 ml syringe, pull out, label. I forgot to say I'm going to label my insulin syringe as well. I'm still in the med room, so I'm labeling my insulin syringe, my PO medication, and my IM medication. I verify again. I had the right needle. I had the right, for the IM injection, I had the right dose, 2 mLs for 4 milligrams. It's going to be IM, and I have labeled it before I leave the med room. I set this aside with my other medications. My vials away. So I'm done with my second check. I'm going to move to my third check, which is administering the medication. So this is my patient here. This is Marge Simpson. So I have my medications prepped. I have my water for my PO, and my my sub-Q and my IM injections with me. I knock on the door. Hello, Mrs. Simpson, it's Travis. I'm your student nurse. I'm here to give you some medications. Can you please tell me your name and date of birth? She tells me her name and date of birth. I got my MAR up. I visually matched the wristband with the MAR, so I verified I have the right patient. I go ahead and I barcode scan the patient's wristband. As I'm looking, I can see the allergy wristband that she's allergic to sulfa and penicillin. I'm not giving either of those medications, so I've checked for allergies. Again, I barcode scan the wristband. This is my scanner. I ask her just to verify. I see you're allergic to penicillin and sulfa. Are you allergic to anything else? She tells me no. I say, great, okay, I'm not going to be giving you any of those meds today. She's like, okay, great. So I've now checked, I have 2 identifiers, and I've checked her allergies, so I have the right patient, and nothing I need to worry about allergy-wise. I'm going to go through the MAR and say, let's see, I'm going to give you your pill first, okay? And it's going to be 325 milligrams of acetaminophen. What's your pain level at? From 0 to 10, 0 being no pain at all, 10 being the worst pain of your life. She tells me a 7. So I'm in the MAR. I would first scan the acetaminophen, so beep. It pulls up, I click the appropriate box on the electronic MAR. I note the time, it's 9 a.m. I put the dose, 325 milligrams, matches up with the dose by mouth, so I've checked what's in my hand, and I match it with the order again in the MAR, and I've documented appropriately that the time, the med, the dose, and the route. So I've triple checked. I'd also document the comments section, pain is 7 out of 10, or whatever the patient reports. I would click update my chart. Now everything is documented in the MAR. I have donned gloves at this point. I would take the pill, remove the cover. I have my pill cup. I'd have my glass of water, as I said. I take the pill, empty it into the pill cup. I give this to Mrs. Simpson. Here, Mrs. Simpson, here's your acetaminophen. And then she takes that with water. That's done. So I now move on to my next medication to administer, which is MPH insulin. I go ahead and pull it up on the MAR. I scan the insulin with the label that I put on, beep. I had trouble keeping the labels on these before, that's why they're not on there. I scan the barcode, it pulls up. I document when I'm giving the med at 9 a.m. I make sure, again, I verify that I have the right patient, Marge Simpson, I have the right drug, MPH insulin, 20 units, right drug, right dose. It's in a sub-Q injection, so the right route. And again, the time is appropriate as it's the order is daily and it has not been given yet. So I go to administer again. Sorry, oh geez, sorry Marge. So I will be administering the sub-Q injection on the abdomen, 2 inches away from the umbilicus. But prior to doing that, I'm going to wipe the lid, wipe the appropriate area for 15 seconds. Again, 2 inches away from the umbilicus. Allow it to dry. I'm going to pinch the appropriate site. I'm going to go in at a 90-degree angle, dart-like 90-degree angle, administer the medication, slowly, not too fast. Take it straight out, release. I'm going to engage the safety and then put this into a puncture-proof sharps container. So I'm done with that one. My last med to give is the ondansetron, the Zofran. I again verify, I scan it, beep. I have the right patient, Marge Simpson. She's getting Zofran because she reported that she was nauseous. It's 9 a.m. and it's been 6 hours since the last dose. The order is for Q4 hours, as needed for nausea. So I have it labeled in my hand. I double checked I had the right medication, I had the right patient. It's ondansetron, it's the right med, 4 milligrams or 2 mLs. I have the right dose. It's an IM injection with the appropriate needle on top. I have the right route, and I verified the time already. So I document in the MAR. I'm giving 4 milligrams of ondansetron at 9 a.m. IM. And since it's 2 mLs, I'm probably going to give it to a big muscle, most likely below the waist. You could also give it in the deltoid. But probably I would give it in the vastus lateralis or the ventrogluteal. As I said, the only other one I would probably do is the deltoid. So again, I have my patient. I'm going to scrub with an alcohol wipe for 15 seconds. Again, I have gloves on. I'm going to allow it to dry. I'm going to uncap my needle away from me. I'm going to pull the safety out of the way. I'm going to go in. Instead of pinching, I'm going to pull taut at the vastus lateralis. I'm going to go in dart-like at a 90-degree angle and administer the medication slowly. And pull straight out. I'm going to engage the safety and put into the appropriate puncture-proof sharps container. Never recap. If there was bleeding, I would take some gauze and just pat dry. I wouldn't wipe hard. I would just pat dry, making sure not to push too hard, apply too much pressure. Make sure that I would maintain the patient's privacy and comfort throughout this entire process, and ask them if they had any questions and answer those questions appropriately.